Student, good day. And now we start our lectures today. Topic of our lectures, thermal and chemical burns. Student, burn injuries are considered to be one of the most painful and traumatic personal injuries a person can suffer. And burn is defined as tissue damage caused by a variety of agents, such as the heat, chemicals, electricity, sunlight, excessive sun exposure, or nuclear radiation. Burn caused by scalds, building fires, and flammable liquids and gases are the most common. Several factors are used to determine the severity of a burn, including the patient's age, location of the burn, and depth and size of the burn. Burns have a variety of the causes. The type of burn is not based on the cause of it. No, scalding, for example, can cause all three burns, depending on how hot the liquid is and how long it stays in contact with the skin. Chemical and electrical burns warrant immediate medical attention because they can affect the inside of the body. Even its skin damage is minor. Burns are classified according to the depth of tissue destruction as a superficial, partial, thickness injuries, deep partial thickness injuries, all full thickness injuries. There are three primary types of the burn: first, second, and third degree. Each degree is based on the severity of damage to the skin, with the first degree being the most minor and the third degree being the most severe. Damage includes first degree burns. Red, its clinical symptoms, student. First degree burns have the red, non-blistered skin. Second degree burns have the blisters and some thickening of the skin. And third degree burns have the widespread thickness with the white and leathery appearance. Student, now you can see on this slide the morphologist characteristics of the burn. And the first pictures, you can see the normal healthy skin. And in here you can see the structure of the skin. Now let's remember epidermis, dermis, subcutaneous tissue, and muscular tissue. In here, it's normal health. And now you can see the injuries with the first degree burn injuries. The first degree burn injuries affected the epidermis, only epidermis, and don't affect subcutaneous tissue and don't affect muscular tissue, only epidermis. And clinical symptoms of this first degree burn injuries and redness of the skin and swelling. Next pictures, you can see the second degree burn injury. And in these pictures, you can see the second degree burn injuries when the affects the epidermis and beginning part subcutaneous tissue. And you can see the clinical symptoms of this second degree burn injury. It's redness, swelling, like the first degree. But to add of these injuries, the blisters, development of the blisters. And next degree of the burn injuries is third degree burn injuries. Third degree burn injuries when the patient have damage of the skin, all skin, and damage subcutaneous tissue and maybe other tissue, maybe muscles tissue, maybe bones tissue, maybe dense tissue. It's third degree burn injury. Okay. In this slide, you can see the primary tanning can cause burns. It's very commonly caused by superficial burns. Anybody of you had a tanning like a burns, and in here you can see the clinical symptoms of this primary first degree burn. No, you can see in here the redness of the skin and small swelling. But in some locals, some foci, you can see the development of the blisters in here and in here. And these patients have mixed burn. A large skin have effect like the first degree of the burn, and some focus have the signs a second burn degree. No, on this slide, you can see signs only first degree burn. And now you can see the redness of the skin and a small swelling of the skin. These signs of the first degree of the burn. Next, in here you can see the clinical symptoms of the second degree burn. The first degree burn and second degree burn related to the superficial injuries and involves the inner epidermis and no more than the upper third of the dermis is heat destroyed. Rapid healing occurs in 1-2 weeks because of the large amount of the remaining skin and good blood supplies. Scar is uncommon for the second degree burns. Initial pain is the most severe of any burn, as the nerve ending on the skin are exposed to the air. Debridement of the affected skin to expose underlying wounds. Debride blisters that are limited joint movements. A clean wound and imply antimicrobial ointment, such as bacitracin. And excellent alternative is the use of skin substitute which seals the wounds decrease pain. And in these pictures you can see the all signs, clinical symptoms, the second degree burn. You can see the redness of the skin, you can see the swelling of the skin, and you can see the blisters. Content of these blisters is transparent liquid. Okay, and in here, in these pictures, you can see too the second degree burn. It's a palm, injuries of the palm, and you can see in here the clinical symptoms of the second degree burns. Redness of the skin, swelling of the skin, and you can see the blisters, some locals in here, and in here. Content of these blisters, it's transparent liquid. If your content of these blisters is a red color, it's very commonly it's a third degree injuries. But now you can see the content of these blisters is transparent. It's the term that is second degree burns. Okay. And in here we see burn injuries received while tanning. Don't operate. While tanning can to cause the first and the second degree of the burn. And now you can see on this slide this clinical signs. The first burn in here, and some fossa. You can see the blisters. It's clinical signs of second degree burns. This patient have the mixed burns, first and second degree injuries. Okay, next slide you can see the two burns, total body, and now you can see the signs of the first degree, second degree, and some locals. You can see the third degree of the injuries of the skin. Okay, and now next degree of the burn. It's fourth degree of the burn. Third degree of the burn. When except the skin, injuries affects other tissue under the skin, subcutaneous tissue, bone tissue, muscular tissue, and tends. It's clinical signs of the third burn degree. Okay, and in here too you can see the student. As I told you, the first and second degree related to the superficial burn injuries, and the third degree related to the deep bones degree related to the deep injuries of the bone. And now you can see the third degree of the bone. Third degree of the bone. And here on this slide you can see when the patient has the injuries of the total body with different foci of the bone injuries. Some foci have the third degree bone injuries, some foci have the second and one and second degree of the bone injuries. Okay, так, student. In here you can see the rules. How to define, how to determine what bone degree have these patients, and when the patients have the superficial bone injuries, we can make the testing. We can make the testing. Student, we take the gauze and wet it with alcohol, and we touch the gauze with alcohol to the bone fossa. If the patients feel the pain, it's superficial bone injuries. If your patients have not feel the pain, it's commonly the third degree of bone injuries. No, as you told, then touch the bone wounds, and if patient feels the action, it means second degree. If sensations absence, it means third degree burns. It means third degree burns. It's testing for different, for the term degree of the bone injuries. Okay, thermal burns of first, second, third degree with an area of 15 to 20%, and deep burns of 5 to 10% are characterized as a local lesion and are not accompanied by a violation of the part of internal organs, of total organs. Student, it's called as a localized injuries. If patient have thermal burns all degree, first, second, and third degree, with the area more than this date, more than 20% superficial burns, and deep burns more than 10%. We meet these patients with the bone disease, with the effects and injuries of the internal organs. Student, on the slide you can see the rule how to determine size of bone injuries. And the first rules, the rules of the palm. The size of palm, any patients about the 1 and 1.1% of surface of his body. And when we when we determine surface of burn injuries with these rules, we touch our palm the patients. We touch palm the patient with to the burn injuries, and we can determine what size burn injuries have these patients. Now, for example, if your size of burn injuries about the two palm surface, it's 2%. If the size of burn injuries about the 10 size of the palm, it's 10%. And now I can see the next methods estimating the size of the burn. It's very commonly can use this methods estimating the size of the burn, and these rules are called as the rules of 9%. And you can see different systems have been developed to estimate the percentage of total skin, total body surface area that has been burned. One of the older systems is known as the rule of nines, which is based on the road approximation that each arm has 9% of the body total skin. The head have 9%, surface of the head have 9% of total body size. Each legs have 18%. The front of the torso have the 18% size of the total body, and the back of the torso to have 18%. And the neck have the 1% surface of the total body. And in the slide you can see in here head surface of the bed, surface of the head have the 9% related to total body, 9% of surface. Torso have torso and back have 18% surface of the torso have 18% related to the total body, and back to have the 18% to the total body. Neck have 1% to related the total body size surface, and leg have the 19 or total leg one leg have the 18% related to the total body size. And palm, as I told you, have the 1% size related to the total surface to the total body. Neck and palm have 1%. And in here you can see the special method estimated of the surface bone, like this special table. But in real life, we can use methods of 9, and the methods of the rule of the palm. it's very commonly can use for real medicine. Student, the bone disease develop when the affected area is more than 15% of the body, and bone disease and the main stage of its development. For like syndromes can be divided into four main stages, each of which is characterized by specific symptoms and is accompanied by a number of the change. Okay, and now I tell you about the fourth stage of the bone disease. The first periods of bone disease is periods of bone shock. Bone shock, as is known, bone causes severe pain, which are collected from all over the affected area of the body and transferred to the nervous system. Such intense nervous impulses can cause a state of shock. First, the victim becomes extremely excitable, and then, on the contrary, to depressed. The body temperature rises sharply and then holds for no apparent reason. The shock affects other pain centers, including the centers of circulation and respiration. The patient is observed change in the composition of blood, drop in the blood pressure, and problems with the kidneys. Duration of this period about the 1 to 3 days. And then the patient has the second periods. It is mainly associated with the blood entering the toxic decomposition products beyond tissues. This toxic affect literally all over the body, making it difficult for the liver and kidneys. Then begins the inflammatory process in the lung. The patient has a fever occurs. This period is characterized by the development of post-burn anemia, damaged surface abscesses, and becomes the gateway to penetrate the weakened body of a secondary infection. All surface of burn injuries is gateway for infection. Its second periods and second periods called as a toxemia, period of toxemia. Second period, duration of second periods, about the 5-7 days. Then we have the third periods of burn disease. Third periods burn disease occurs after about the 10 days. 10 days? No, it's 1 to 3 days of burn shock periods, and about the 7 days second periods, and start the periods third periods. It is accompanied by severe inflammation and complications, including purulent nephritis, pneumonia, and disease of other organs and tissue. The third period, it's periods septicemia. Second periods toxemia. The third period, septicatoxemia. It's period of genital infection of the body. And next period of burn disease, fourth period. Fourth period develops slowly and in the results of excisions. At this time, there are purulent complications and eating disorders of tissue and organs leading to their slow atrophy. Student, it's a 4 period of burn disease. Let's repeat. The first period burn shock. It's very dangerous periods. All three periods of burn disease is very dangerous periods. The first burn shock. The second periods of toxemia. The third periods and periods septicatoxemia. All the three periods, it's very dangerous for patients. And all three periods can be led to the death of these patients. And the fourth periods, it's time there are purulent complications and eating disorders of tissue and organs leading to the slow atrophy. But fourth period, this period reconvalescence. Okay, and now we tell about the complication of the burn injuries. Deep or widespread burns can lead to many complications, including, at the first place, it's infection. Burn can leave skin vulnerable to bacterial infection and increase your risk of sepsis. Sepsis is a life-threatening infection that travels through the bloodstream and affected your whole body. It progresses rapidly and can cause shock and organ failures. Next complication, low blood volume. Burns can damage blood vessels and cause fluid loss. This may result in low blood volume, hypovolemia. Severe blood and fluid loss prevents the heat from pumping enough book to the body. Very important for low blood volume, liquorrhea. Through the whole surface of burn injuries, the patient have liquorrhea, loss of the liquid part of the blood. And now, if you can see this patient on the bed, we can see all bed linen, it's wet. It's results of liquorrhea and loss of the liquid part of the blood. Next complication. Dangerously low body temperature. The skin helps control the body's temperature, so when large portions of the skin is injured, you lose body heat. This increases your risk of dangerously low body temperature. hypothermia. Hypothermia is a condition in which the body loses heat faster than it can produce heats. It's the third complication of burn injuries. And fourth complication is breathing problems. Breathing hot air or smoke can burn airways and cause breathing respiratory difficulties. Smoke inhalation damages the lung and can cause respiratory failure. It's a very this burn injuries of the airways and tissue of the lung led to pneumonia, burns pneumonia, very dangerous injuries of the lung, very dangerous. Next complication is the scarring of the skin and the subcutaneous tissue. Burns can cause scars and rigid areas caused by the overgrowth of scar tissue, as they called keloid scars. It's too very dangerous complication, but this complication older time of burns recovers. And next complication is bone and joint problems. The burns can limited movement of the bones and joints. Scar tissue can form and cause shortening and tightening of the skin. Muscles of tendons, contractures. This condition may permanently pull joint out of position. Problems of bone and joint, it's two very important problems. Okay, it should be noted that the severity of burn disease depends on how quickly and correctly the patient was given medical assistance. It's right. Student, and now I can see the methods and device for treatment this patient with the burns. On this slide, you can see the special bed for treatment patient with the burns injuries. Now you can see the bed. This bed provides extremely low contact pressure, approximately 12 millimeters of the mercury. And therapy creates a condition for the maximal possible comfort of this patient, significantly relieves pain, sever to the prevent and treat bed sores. And now I explain how to work this bed. Student, this bed have on upper surface of this bed have the a lot small hole, and this apparatus enter the air flow of the air flow through the lot hole on the upper surface of the bed, and the patient seems to be hanging in the air. Flow air hanging the patient in here, and the patient don't feel relieve the pain and more comfort on this bed. Okay, and you on this slide you can see as a device for care of the patients with the burn injuries. It's bed for this patient with burn injuries, and this device for turn around this patient, remove this patient from the bed. Okay, and now, student, on the slide you can see the complication, long-time complication, patient with burn injuries, and you can see the scars, keloid scars and other scars, complications, long-time periods after the burn injuries. Нет. Уйдите. Вы что? And in this slide you can see the complications. Whole body, its total body, burn injuries, and these complications, all-time complications after the burn injuries. We can see the scar in here, keloid scar, its complications. Student, now I tell you about the some moments of the treatment of burn injuries. Surface burn injuries can be treated the special oils. Omniderm is the most effective wounds cutting in the treatment of burn the first 2 to 3 degree. Protection and treatment of the burn wound, protection of fresh skin, grafts protection and treatment of the donor sites during skin transplantations. Student, and there you can see the thermal burns in here, thermal burns of 4 days after injuries, and thermal burns for 7 days of thermal burns injury in here with the treatment of overderm. And in here you can see the on 11 days after the burn injuries and 14 days after the burn injuries in here. The results of the treatment on derm. And you can see this omniderm. Okay, so other methods, different methods for treatment burn injuries. It's a special camera, and inside this camera we have the sterile air with a spray of the drugs. Its method treatment of local burn injuries. Now you can see the local burn injuries of the feet. And this methods it's very comfort methods. When inside this camera we have the sterile air with the spray of the drug for treatment the patients. And now you can see the remodeling surgery. This patient has the complication of after the burn injuries, And in these pictures you can see the remodeling surgery for remove this keloid scars with using the balloon, special balloon. And that's existing part of the skin. Existing part of the skin. This results of surgery. Omniderm is a sterile dressing material which is a flexible transparent polymer films membranes about 20 microns thick, obtained as a result of radiation transplantation of hydrophilic monomers on a polyurethane base. Due to the presence of polymer networks consisting of microscopic cells, the membrane is able to pass small molecules of oxygen and waters, but at the same times prevents the passage of the large molecules of microorganisms and proteins. Those similar to natural skin, the films allow these tissues under to the breeze. Normal gas exchange occurs and release moisture, but at the same time creates an barrier to infection. Hydrophility, the highest throughput for liquid, up to 8 liters of exchange exudate per 1 square meters of wound surface per day. Allows the use antibacterial agents to put off this film with distributing the wounds. Student, now we can continue our lectures, and now we tell about the frostbite and electrical injuries. Okay, let's continue. Student, frostbite, the next important problem of surgery. Frostbite, as a cold congelatio, on Latin words. Latin word. Frostbite is the most important problem of surgery in peace time and wartime. According to the Norilsk Center for Thermal Pathology, burns in the structure of thermal trauma account for 69.5%, and frostbite is 30.5%. The burns about the 70% thermal trauma burns 70%, and frostbite about the 30% thermal injuries. And frostbite with a mortality rate of the 7.3%, and disability about the 40%. It's two very important problems, thermal pathology. Student, now you can see the classification of cold lesions. This classification of Kotelnikov, and we can see all cold lesions divided two groups: acute and chronic cold lesions. Acute cold lesions and chronic cold lesions. Acute cold lesions divided to type. The first type is freezing, and second type frostbite. What is it? Freezing. Freezing, it's general injuries the whole body. And frostbite, it's local focus injuries. And the chronic cold lesion, the result is prolonged overcooling. Result of prolonged overcooling. And chronic cold lesions divided to two types. The first type, chills, and the second type is called neurovasculitis. Student, now I show you the chronic occurring injuries, cold injuries. Now, for example, in here you can see the trench foot. What is a trench foot? Trench foot is a lesion of the distal parts of the feet that occurred against the background and fight humidity and low, but not sub-zero temperature. Symptoms include cyanosis of affected areas, finger, sometimes metatarsals. Include swelling, disappearance, all weakening of pulsation in the peripheral arteries. With severe injuries, blisters form, areas of necrosis form. Pathology is diagnosis on the basis complaints, amnesis date, and the results of the objective examination. Treatment includes drug therapy, physical therapy, and according to the indication, bandage and operation are carried out. In this slide, you can see the symptoms of chronic cold injuries. In here and in here. It's called as a trench foot. Okay, and now we tell about the two periods during frostbite. There are two periods during frostbite. Pre-reactive, before the warming up, when the patient gets the frostbite, and before the warming up. It's called as pre-reactive periods. And reactive periods. This patient get the frostbite, and this patient gets the warming up, and this period called as a reactive. And this reactive period divided to early period and late periods. So now we can say the classification of the frostbite divided 4 degree. The first degree, second degree, third degree, and fourth degree, depending on the depth of injuries, with the cold injuries. In this slide, you can see the first degree of cold injuries. The skin in the affected areas become edematous, hyperemia in here, with cyanotic or Meyer-Blade coloration. Meyer-Blade, you can see in here, Meyer-Blade coloration. Cyanosis and Meyer-Blade coloration. Так. Necrosis for the first degree does not develop. Necrosis does not develop. It's affected only surface layer of the skin, epidermis. Next, next degree is second degree of frostbite, and this you can see the symptoms, clinical symptoms of the second degree of frostbite. Partial death of the skin to the germ layer, the appearance of bubbles filled with the transparent of yellowish bloody. Jelly-like contents. This blood, this transparent content of these balls, jelly-like contents. The bottom of the which retains sensitivity to touch. Wound defect heal on the wound. And this you can see the clinical symptoms of the second degree of frostbite. Redness of the skin, some swelling of this tissue, and you can see the bubbles. It's clinical signs of second degree of frostbite. Content of these bubbles, of the blisters. Content of the blisters is transparent. Okay. And the next degree of the cold injuries is third degree of frostbite. Grade third is characterized by the formation of blisters with hemorrhagic contents. Student, in this you can see the blisters, bubbles in here. And content of these bubbles, hemorrhagic, red color. It's the third degree of frostbite, and when the patient has the third degree of frostbite, this patient has the necrosis of the skin. And patient with the third degree of frostbite need to surgery. Okay, and frostbite of the fourth degree occurs with prolonged exposure to cold. The decrease in temperature in the tissue with it is greatest. It is often combined with the frostbite of the third and even second degree. The damaged area of a limb is sharply blush, sometimes with marble coloring. Edema develop immediately after warming up and increase rapidly. The absence of blisters with significantly developing edema, loss of sensitivity, indicate frostbite of the 4 degree. It's 4 degree of cold injuries, frostbite. So, and now you can see the frostbite, the fourth degree, and you can see the clinical signs of death tissue, in here death tissue, and now we can see the healthy tissue in here. This board between this death tissue and the healthy tissue. And on the second pictures you can see the results of the surgery. This patient with the frostbite, fourth degree. Results, it's amputation of the finger. On the first pictures you can see this finger, tissue of this finger is death, and this patient need to amputation all fingers. And in here you can see the results of this surgery. All patients with fourth degree of frostbite need to surgery, and very commonly it's amputation. It's amputations. Так, first aid for frostbite include 3 components. The first component, applying a thermal isolating bandage. Below I show you this thermal isolating bandage. First component, first aid, applying a thermal insulating bandage. The second component, immobilization of the hand, of the leg, immobilization. And third component, warming of the proximal part of the limb that has not undergone frostbite. So, and in the slide you can see the thermal isolation bandage. On second pictures you can see the scheme of this thermal isolation bandage, and you can see this special materials, maybe gauze, maybe other materials, synthepons materials, so thermal isolations. And these materials need to fix like this for the cotton materials, fixing these thermal materials, and it's called as a thermal isolation bandage. It's the first component, first aid the patient with the frostbite. Student, and next injuries, electropathology. Now we tell about the electropathology injuries. Electropathology injuries is a branch of medicine that studies the cause, pathogenesis, and treatment of general and local electric shock. In electrical engineering and electropathology, currents are divided into current up to 1000 volts and current over the 1000 volts. Deaths are more likely to occur from currents of 200 to 127 volts, as they cause ventricular fibrillations. And when exposed to the current of 1000 and over 1000 volts, people are more likely to die from the extensive burns. At the same voltage, alternating currents is more dangerous than direct current. Direct current of 108 volts is equivalent in danger to an alternating current of 36 volts. The high frequency current is less dangerous than the low frequency currents. Student, electrotrauma, according to the degree of damage, are divided according to Frankel. The first degree electrotrauma with convulsive contraction of muscles without loss of consciousness. It's first degree. The second degree, clinical symptoms of second degree, convulsive contraction of muscles with loss of consciousness. The first degree without loss of consciousness, the second degree with loss of consciousness. And third degree of electrotrauma, convulsion with loss of consciousness and violation of cardiac and respiratory activity. Fourth degree, it's clinic death. Fourth degree of electrotrauma, and let's repeat: the first degree, convulsion, contraction on muscles without the loss of consciousness. Second degree, convulsion, contraction of muscles with loss of consciousness. Third degree, convulsions with loss of consciousness and violation of cardiac and respiratory activity. And fourth degree electrotrauma, it's clinical death. It's results of fibrillation of the heart muscles. Okay, and now you can see the first aid when we meet the patient with the electrotrauma. Student, it is necessary to disconnect the current carrying object from the victim. To do this, turn off the switch. But if they are far away, then it is necessary to pull out all cut the wire. Discard it with dry wooden stick, all other dry object that does not conduct current. You can drag the victim by the floors of dry clothes, but in no case should you take the victim by the bare parts of the body. And when releasing the victim from the effect of the current, the assisting person himself must protect himself. It is necessary to wear rubber boots, galoshes, gloves, and all stand on rubber mat. This rule are especially strictly observed when being in a humid environment, especially on the moist soil. You can give the command fall, jump up, in the absence of breathing and cardiac activity. Precardial stroke, artificial respiration, and close heat massage are performed. It's the first aid. Student, treatment of electrotrauma. If infective, then an tracheostoma, open head massage, tracheal intubation, and ventilators. Defibrillation with the ventricular fibrillation is performed by the resuscitator ambulance doctors. And the solution: polyglucine, rifampicin, stabizole, infocol, ribavirin, prednisolone cardiac agents are administered intravenously. Patients who have had a loss of consciousness are hospitalized, and the following treatment is prescribed to them: complete rest with the bed rest for 2 days, as they may be late. Secondary respiratory and cardiac disorders. When excited, chloral hydrate, seduxan, relanium, and are prescribed. With increased intracranial pressure, 40% glucose, 20 milliliters intravenously is prescribed. Sometimes a spinal puncture is performed. If, according to electrocardiogram date, there is bradycardia and spasm of coronary vessels, then Validol, nitroglycerin, and are prescribed, and sleeping pills. Student, in this slide you can see the electric burns. When the voltage of this injury is more than 1000 volts. Electric burns at the points of contact of the current source with the body. Electricity is converted into thermal energy, which causes tissue coagulation. At a voltage of more than 380 burn injury in here the third and fourth degree. First aid and treatment of electric burns are carried out according to the rules of the treatment of thermal burns. Small currents can give small burns in the form of current signs, in the form of an object in contact with the skin. Okay, student, today it's finish our lectures, and next lectures we have the wounds and wounds process. Goodbye.